Welcome to our WeCare clinical presentation. My name is Dr. Philip Havale, one of the clinical pharmacists on the WeCare team. This presentation is to explain what our diabetes and dyslipidemia medication therapy management program is all about. Our mission statement at WeCare is that we strive to promote and ensure optimal therapeutic outcomes through pharmacist-run medication therapy management. Our goals include successfully improving the quality of life for each patient, providing the highest standard of clinical services, reducing overall healthcare costs, and fostering relationships between patients, physicians, pharmacists, and payers. Our WeCare team consists of 5 clinical pharmacists, 1 consultant physician, 1 clinical dietitian, 3 pharmacy technicians, and 9 call center associates. WeCare is comprised of 3 essential components. We are the primary provider of diabetic testing supplies for IEHP patients. Patients that are signed up to receive our diabetic supplies are also enrolled in the second component, the clinical monitoring program. As of January 2013, WeCare has launched the third component, the clinical management services for eligible physicians. These services will be detailed in a few slides. WeCare is partnered with IEHP, the largest health plan in the Inland Empire. Our mutual contract is to reduce overall healthcare costs for the insurance company. As we all know, by better controlling our patients' diabetes, we are preventing a slew of additional costs. These costs include admissions into the hospital, unnecessary medication utilization, and complications associated with disease progression such as renal failure, partial to full blindness, infection, and amputation. Our partner, IEHP, is contracted with the diabetic supplies wholesaler WeCare. We provide our patients with a 3-month supply of the WeCare glucometers, test strips, and lancets through the mail. This also includes an educational packet. The WeCare devices offer a new technology called telehealth. By communicating with routers in the patient's home, the telehealth technology can send point-of-care glucose readings directly to the WeCare clinical staff and also the physician's office. This ensures real-time treatment assessments, precise logging, and patient compliance. Our primary objective at WeCare is to ensure the best outcomes possible for the patient. With our patient being the central focus, WeCare's goal is to maximize effective communication between IEHP, the physician's office, and our clinical team at WeCare. Shown here are baseline statistics for IEHP. As you can see, the total number of diabetic patients under IEHP is a little more than 26,000. WeCare encompasses around 10,000 of these patients that are under our diabetic supplies and clinical services. As our numbers increase rapidly, we are working hard to decrease the amount of uncontrolled patients. To sign up new patients with WeCare, the physician must simply fill out the referral form that is provided to the physician's office. The clinical pharmacists provide all physician offices that have WeCare patients with 3 items. These items are the patient snapshot, the patient summary chart, and the individualized treatment plans. These 3 items will be provided through an in-person visit, a fax, or an email for the physician's office records. The items are meant to act as a safety net for the physician, identifying uncontrolled patients and patients that can benefit from optimizing therapy. These items will be provided regardless of whether the physician is signed up for the clinical management program. The first item, the patient snapshot, shows a list of all the physician's patients under WeCare. This is utilized as a quick view reference tool to identify which patients have an A1C greater than 7, are eligible for a new A1C lab, do not have an ACE or ARB on file for renal protection, have an LDL greater than 100, patients that are eligible for a new LDL lab, and patients that do not have a statin on file for dyslipidemia. This snapshot can also be used to identify P4P incentives for the physician's office. New labs are indicated every 3 months for uncontrolled A1C or LDL, and 6 months for controlled A1C or LDL. The next item shows the same list of patients but with a more detailed summary. This summary includes the latest readings of the patient's A1C, LDL, and triglycerides, and the corresponding dates these labs were performed. It also includes a list of medications that are specifically used for diabetes and dyslipidemia that were billed by IEHP in the last 5 months. This is regardless of which pharmacy the patient uses. This is a valuable tool to quickly identify the medications that patients are taking and to also gauge patients' compliance. The far right column of the summary chart shows the clinical pharmacist's notes specifically for that patient. These notes will cover recommendations in updating certain labs, initiating or titrating medications, discontinuing harmful or unnecessary therapy, and identifying significant medication interactions. The third item is the individualized treatment plan for the patient. This is the same information from the summary chart organized to a specific patient for charting purposes. These individualized sheets are available upon request of the physician's office. Here is a close-up view of what the pharmacist's recommendations look like. Recommendations and modifications are classified as medication therapy management, or MTM. The definition of medication therapy management is clinical pharmacists working collaboratively with physicians and other healthcare providers to optimize medication utilization and improve patient outcomes in accordance with evidence-based guidelines. Various studies have displayed the positive effects of utilizing MTM. These improvements have been documented for both clinical outcomes and cost effectiveness. WeCare offers the clinical management program for eligible physicians. Eligible physicians are physicians that have IEHP diabetic patients and are also referred to WeCare. These clinical services are the following: patient education. This is to assist the patient in further understanding of their diabetes and the importance of management. Education also includes instructing patients on what their medications are and how to properly use them. Comprehensive nutritional counseling. This service is conducted by our clinical dietitian. A thorough evaluation is done to identify the patient's baseline diet and current BMI. The patient is then educated on nutrition and a dietary treatment plan is initiated specifically for that patient. Patient laboratory ordering. This is done by our clinical pharmacists who first identify patients that are eligible for new or updated labs. This information is found using the IAHP online patient database. The clinical pharmacists then order these necessary labs on behalf of the physician. WeCare can assist in maximizing the P4P incentives for physicians through the ordering of labs and ensuring that the patient is adherent to the lab order. Note: the lab results will be sent back to the physician's office, which then must be billed through IEHP for the P4P incentive. Diabetes and dyslipidemia medication therapy management. These are conducted by the clinical pharmacists as well. Under these services, the clinical pharmacists are initiating, titrating, and/or discontinuing certain medications on behalf of the physician. These modifications to the patient's therapy are followed strictly from the clinical management protocol, which is solely based on the American Diabetes Association Guidelines of Therapy. ACE or ARBs addition. These medications will be added on for renal protective therapy to patients that meet the criteria. This addition will also be made on the physician's behalf by the clinical pharmacists. This flowchart is an example of how the clinical pharmacists conduct their therapeutic modifications. This algorithm is specifically for diabetes management, displaying the overview of treatment choices based on patient laboratory values. As a recap, the following are exactly how WeCare can benefit the physician's clinic. Ultimately, we can help reduce physician management time per patient, identify uncontrolled patients for clinical management through our WeCare IEHP database, provide sound individualized treatment plans per patient, patient-specific education, including medication and nutritional consultations, maximize P4P incentives for physicians, relay information on behalf of providers as we are in full contact with the patients through telephone and their mailing addresses, and telehealth monitoring of blood glucose and blood pressures in the future. Because IEHP is contracted with WeCare to optimize patient outcomes, IEHP is funding the program, and as of now these services are of no cost to the physician. Before the physician can sign up for the clinical management program, a team of 2 clinical pharmacists will visit the physician's office to gather patient baseline information and progress notes from the patient's charts. The physician is to then thoroughly review the clinical management protocol prior to signing up for the clinical management program. If the physician wants to modify the protocol, the changes will be fully documented as the clinical pharmacist will follow the protocol verbatim and will not deviate from it at any time. The WeCare Collaborative Agreement form can then be signed, which enrolls the physician's patients into the WeCare clinical management services of the physician's choice. WeCare is strongly dedicated to benefit each and every patient with your collaboration because, as our name says it best, we care.